Welcome to From the Chair, where better health starts with better conversations. I'm Charlene Shirk, and today we're talking about a dental solution that can completely change your life. Full mouth dental implants. If you've ever felt like your teeth or gums are too far gone, our guest today is here to tell you otherwise. Joining us is Dr. Skyler Holcomb, the owner and founder of ATL Dental Implants. Dr. Holcomb, thank you so much for being here today.
Thank you for having me.
I know you've got some amazing before and after pictures. Those are always my favorite part. But before we get to that, let's start with the basics. So when we say full mouth reconstruction, what exactly does that mean? And does it go by other names as well?
Yeah, full mouth reconstruction can go by the name of all on X, all on 4, all on 6, teeth express, teeth in a day. It all means the same thing. It's all replacing either broken or failing teeth or people that don't have any teeth. We're replacing them with 4 to 6 implants and creating new teeth that are permanently fixated to those implants.
Okay, so let's walk through the procedure a little bit. Exactly what is involved?
Yeah, so somebody that's got failing teeth or someone that has no teeth, we're able to remove those teeth and place the implants and create new teeth that are fixed to those implants. They don't come in and out, and they leave with those teeth within a day. And then they heal, and then we make them a permanent set 90 days later.
90 days later.
Right.
So let's talk a little bit about that. There's other options out there, right? I mean, people have dentures, people have like the snap-in dentures.
Correct.
So how does this full mouth reconstruction process differ from those other options that are out there that a lot of people have?
Great question. So a traditional denture is something that someone has to remove daily. It can flop around, it may not be very stable, it just kind of rests on the gums. Mm-hmm. One step up from that, you're looking at some dentures that snap onto some implants, and that's a little better, but it still doesn't get you to that full functionality like full mouth fixed implants will get you. You can get that 100% chewing function with the full mouth implants.
And you mentioned kind of some of the issues with those with the dentures and the snap-on. So when folks come to you, I feel like they're ready to have a different conversation, right? Maybe they've had those other things and they're like, it's just too much involved with those.
Absolutely. Most people who come in are at their wit's end with their dental treatment, their dental journey that they've been on. It's already been so draining for them financially, mentally, emotionally. So we're able to offer them a solution to kind of start fresh and give them something that will hopefully last the rest of their lives.
You mentioned that you can just envision people coming in just like their wits end. They're just kind of just so frustrated. So who would this be for? Who would really benefit from this? Who are you seeing come through your door?
Really all walks of life, you know, in their 30s up to their 80s, 90s. It could be someone that's dealt with dental decay their whole life, lots of cavities, periodontal disease, people that are already missing teeth, people that have been battling drug addiction. Really, this can be applied to any situation for someone that needs something to get them back to where they used to be.
Where they used to be, or maybe where they've never been before.
Where they've never been before, exactly right, yeah.
Now, are there any health concerns or issues that maybe this might prohibit somebody from being able to have this procedure?
Few and far between, honestly, and a lot of people come in and they've been told that maybe they're not a candidate for one reason or another, maybe a past medical history or they don't have enough bone, which is a common thing that we hear. And more often than not, these patients end up being great candidates for it, and it works really well for them. And we're kind of like their last chance to get back something they never had or get something that they used to have that they don't have anymore.
So let's talk a little bit about what this looks like for a patient, right? So what can somebody expect from they're walking through that door, they're ready to have this conversation with their first consultation, to getting their new fabulous smile?
The first thing they're going to notice when they walk into our practice is just a warm, welcoming, no judgment zone, because so many people they don't want to show their face, they don't want to smile, they're embarrassed about what they've got going on, and that's why they didn't go anywhere before. And so we always praise these patients when they walk through our doors, like, you've made a huge first step, just come in here. And we want you to feel safe here, because we're trying to be your solution, not your problem. And so that's the biggest thing that we see is once we can get them over that hump and get them through the doors, things end up being a lot smoother. We try to, build these people up because they've dealt with it for so long.
And what's the process like? So they've made that first step.
Yeah.
Is this when they have the consultation with you, like walk me through a little bit of the process, because sometimes, it takes a lot of time. You have to go to a lot of appointments. You've got to get x-rays. There's a lot of follow-ups. So let's talk a little bit about how you're able to streamline the process.
Yeah, so everything we do is under one roof. We're not having to send these patients to all these different locations like a lot of practices do. We are a one-stop shop. Everything is in-house for us. So these patients come in for a consultation. If they decide they're ready to move forward, we have one appointment to gather some records, and then we're ready to do surgery and change their lives in one surgery. So we're trying to minimize the time that the opportunities that they have to go into surgery. We're trying to minimize that.
Or take time off
work
and get childcare,
exactly.
Drive all over town.
Yep. So these patients
Atlanta
are getting
traffic,
Yes. Oh, that's another
that
story
could be prohibitive
entirely.
just right there.
Yes. So these patients, we're able to get them into a new set of teeth within 2 appointments.
Wow, that's amazing. All right, so you mentioned that everything is done right in your office. You can leave with teeth the very same day. So how does that work? How are you able to do all that where other offices are not able to do that?
We have a great team. We have a great team that understands what we're doing, knows our goals, knows what we need to do. We have our own lab in-house. We get scans in-house, we get designs in-house, we 3D print in-house. So everything we're doing, the staff is trained on how to get from point A to point B to point C. And so we keep all of that in-house. We're not having to send you out to other offices. We're very streamlined, and we do it every day.
Wow. All right. Now, this beautiful smile is certainly a selling point, right? But some people just cannot get over that anxiety. Some people don't even like to go to the dentist for a cleaning, right? That freaks them out. So I think that's a great thing. Hey, you come here, it's not gonna take forever. We're not sending you a million places, right? So you can make that decision, you can move forward with this. But how do you get people past that anxiety and that fear of going through this process?
Well, going back to what I said, when they walk through our doors, we treat them like family. It's a warm, welcoming environment. We want them to be comfortable when they come see us. And because they see us and only us, they're not seeing a whole lot of new faces. So they get familiar with us, they get comfortable with us. We treat them like humans, like people. Their treatment is designed for them personally. And when we treat them like family, they get comfortable and they come back. And so that's some things that a lot of other offices, they don't have that personal touch that we're very proud of. And I think that makes a huge difference on kind of evening out the anxiety that people get. Because like I said, the first time, walking through that door is the biggest step.
Right.
And so we want them to feel comfortable walking through that door a second time.
And that you're here to help them.
Absolutely.
You're here for them on this process and this journey. So, okay. Calm down my anxiety. I'm here. I'm in a very caring environment.
Right.
But some people have, and I shouldn't say some people, everybody has a fear of pain, right? Nobody wants a painful procedure. So how do you address that? How do you help folks get through that part of the process?
Yeah, so any procedure that we do, we offer ways to manage anxiety, whether it's just laughing gas for something like a simple extraction or a single implant, all the way to IV sedation for deep sedation where they're just completely asleep for the whole thing. But the main way that we manage anxiety is through oral sedation. We use a drug called triazolam, which is extremely effective at relaxing the patient, getting them to a spot where we're able to work comfortably. We still get the patient numb using dental anesthetic, so there's no pain, and then they don't remember what we did. So it's kind of like the best of both worlds. We can get that added effect of sedation without having to bring in, an anesthesiologist unless they want that. We offer that, but the vast majority of our patients do fantastic with oral sedation, and we don't charge for that.
And it sounds like it's a two-pronged approach. We're going to make sure that you don't feel anything during the procedure, but we're also going to help you get over that anxiety over that as well. I love that. I love that. So let's talk about, some people are always, especially if they go under the IV sedation, right? People are always worried if they undergo kind of surgery, am I going to remember this? Like, am I going to have, I'm assuming that you guys address that. You're pros, you know how to handle that.
Patients don't remember. The drugs work beautifully in that regard. Highly effective medication for patients not having any memory of what we did.
All right, so let's talk a little bit about the recovery, right? Because that's another thing, right? How much downtime am I going to have? Am I going to be in pain after this?
Right.
You know, when can I start eating again? So let's talk a little bit about how quickly they can get back up and running in their normal life.
Yeah, typically within that first week is when they'll be sore, but it's very rare that I've got somebody who's just talking about I'm in a lot of pain. But after that first week, they're typically back to 100%. They're on a soft food diet because we need those implants to heal. It's about a week of just minor discomfort, and then after that, they're back to their normal life.
I bet you got meds for that too.
We do. We do. Absolutely.
We'll take care of you.
For
So
sure.
you mentioned a couple months before the permanent teeth. Why is waiting that amount of time so important?
So you may have seen other offices may advertise that they go straight to finals within 24 hours, and we're firm believers in the idea of wearing temporary teeth because as you heal, things can happen. As your tissue heals, it may shrink. It may create these little gaps under the teeth, and we don't want you trapping food, causing a hygiene issue that can affect the health of the implants. And a lot of these offices that are doing those 24-hour finals, they have about a 50% remake rate.
Really?
So, and we want to avoid that because we want to create something customized to you, and then once it heals, we want to redo it to the point where it fits nicely so that you're not having issues keeping them clean. You know, it's one of those things where we want to have a nice intimate fit, and you can't have that if you give it the next day.
Well, sure, if your gums are
things are
swelling.
going to shrink, things are going to change.
And so are people wanting to rush into, or other offices rushing into the permanent teeth right away because there's a fear that the temporary teeth aren't as good or don't look as good or aren't as nice or you can't eat with them?
Perhaps. I always go back to one of my favorite quotes when I think about this concept is that just because you can doesn't necessarily mean you should. And it also highlights the point that this is something that may benefit their practice, but it doesn't benefit the patient. So we want to do everything we can to benefit the patient and set them up for long-term success without having to go through the process of redoing something because
Right.
it wasn't done or because things change.
But the temporary teeth look good though, right?
They look beautiful.
Okay.
Yeah, and I can attest to that because I make them myself. So you get a doctor's touch, you know, when you're making these teeth. So I make sure that they look great for these patients.
Okay, because so that you should take the time and let them heal and go through the process. Now,
Yep.
you've helped a lot of patients, you know, I'm sure throughout your career, and you know, it sounds like when you say people are coming in and they're embarrassed or they're hiding, you know, their mouth, even from you, who you're there to talk, to have this whole conversation and see what you can do to help them. You know, how is this impacting people with their daily lives, and how does having this procedure change that?
It's immeasurable, the change that you can make from somebody who doesn't have the confidence to look you in the eye and is afraid that you're looking at their teeth. When you fix that and you get them to where they're able to exude confidence, and not only it changes their lifestyle to be healthier, it gives them more confidence to be able to get a job, go on a date, you know, live their life when they really weren't fulfilling or living their life the way that they could have been.
All right, so you said you're really in the business of changing lives. So let's take a look at some of the lives you've changed.
Sure, yeah. So we're going to start with Tony. He's a fellow healthcare professional in Atlanta. He came in with broken and decayed and cracked teeth, just kind of at his wit's end with his dental issues.
Poor guy.
Yeah, and we determined that he was a great candidate for full mouth upper and lower implants. And as you can see, in his smile, he's missing some teeth. He's got some discoloration. We were able to do a full mouth transformation on him, and we
look
got
at Tony
him.
now.
Yeah,
What a
beautiful,
great
beautiful
smile.
set of teeth. Yeah, and he's able to treat his patients with a higher level of confidence and instill more confidence in his patients.
Sure.
Because when they see his smile like this, they say, "Oh, he takes really good care of himself, and he's going to take really good care of me."
And you talk about people coming in and sometimes they're embarrassed, or you can just see the weight of the world on their shoulders because of how they feel like they're coming across, or they don't have any confidence. And this next patient, wow, this really changed all of his confidence level.
Yeah, this is Prashanth. He came in with 2 teeth that were basically falling out at his consult. He needed an upper arch. He needs a lower arch, and we'll get to that. But we catered to the patient. We treat the patient when we'll do the lower when it's time, but we were able to transform his smile, and we did a full upper arch on him, and just,
look at him.
Look at the difference there.
Look at that difference. Like even his hair is all put together. Like you can just look at his smile. And it's one thing I keep saying, look at the smile, but I'm looking at the eyes when I say that, because you can see the smile in the eyes in these after photos.
Yeah, the transformation that we saw from his pre-op photos to his post-op photos, just the glow up was real.
And so you mentioned earlier that, look, we're here for what's best for the patient, not what's best for the practice.
Yes.
And we were talking about why some other offices will go, other groups will say, okay, we'll send you out the door with your permanent teeth. And this was a perfect example where you said we're kind of doing this in a graduated process because that's what's best for him.
Yeah, so when you come in and you don't have teeth, you don't have a good starting point. So we created him a beautiful set of temporary teeth. But because they're just the temporary teeth, we were able to tweak and fine-tune those temporaries to transition them into a final that was just really spot on. And so if you go straight to finals, you don't really have that opportunity.
So you were describing a little earlier about some of the reasons that people will have damaged or broken or missing teeth, whether it's a health issue, it's a genetic issue, or it's something that they just have never gotten addressed. Some of us are grinders and clenchers, and that can cause a lot of crown cracking. And so you've kind of talked about some decaying under crowns, and I would think that that could probably bring a lot of people to your office as well.
Absolutely. And this next patient is a good example of that. We've got Janice here.
Poor Janice.
Yeah, she's had basically full mouth crowns, and with her clenching and grinding issues, she broke off a significant portion of her front teeth, along with recurrent decay under her crowns. And when you've got those weakened teeth in combination with clenching and grinding, the chance of you just crumbling those teeth goes up. It's really high for that. And so we determined that she needed a full upper arch. Her lower arch was doing pretty good, so we didn't have to mess with that. But yeah, we got her fixed up. We got 6 implants in there, and we completely transformed Janice.
Oh my goodness, and look at Janice now.
Janice, yes, this is my favorite case that I've done. We just delivered her final teeth recently, and she got very emotional in the chair, which in turn got us emotional, got the technician working in the lab emotional. So it was just like, it was a wonderful day to see this transformation and really remind us like why we do this. Yeah, that's the one that's like, yeah, I'm in the right place.
And though she's a grinder and a clencher, she won't have those issues now moving forward.
Yeah, we've got her in a night guard that's tailored to her upper arch. And we'll continue to monitor that, but yeah, it's not going to be an issue for her moving forward.
I mean, you've changed Janice's life with this smile.
She changed our life. So
that's awesome.
Yeah.
All right, so for someone who is watching, they like everything they've seen and they've heard, but they're still a little hesitant. Maybe it's the fear, the pain, the anxiety, the cost. What could you say to them to just take that first step, to get them in the office and have that conversation?
I would just say take that leap of faith. Come in and see what we're about. We're very family oriented. We're going to treat you like family. So yeah, give us a call at 678-750-9193 or visit us at atlimplants.com, where you can book an appointment online, or you can call us to book an appointment. It's really what is most convenient to you, but yeah, take that leap.
And what about the cost? If folks are afraid like, oh, this looks great, but I don't know that this is in my price range.
We are partnered with several different financing companies to give you the most flexible and affordable way to make this happen.
And I got to think that the fear they're feeling today is probably nothing compared to how they're going to feel after.
Yeah, it may be, you may be apprehensive right now, but when it's all said and done, it will be worth it.
Dr. Holcomb, thank you so much for joining us today for this truly inspirational conversation.
My pleasure.
Well, you've been watching From the Chair. I'm Charlene Shirk, and until next time, keep smiling.